Giselle, you seem as though you're ready.
October is Breast Cancer Awareness Month, and breast cancer is the number one cause of cancer in females in North America. In the United States, 1 in 8 women, if they achieve the age of 90, will develop breast cancer.
Definitely. I mean, diet, exercise definitely plays a role. And lately, there have been some studies about alcohol, and even having one drink may increase your risk.
That's true.
So these are things that are definitely modifiable. Weight loss, following a well-balanced diet with lots of fruits and vegetables.
But Roxy, recently you asked me about the studies to screen for breast cancer. Why don't you ask the doctors?
Hi, doctors. Right now, you guys were mentioning about screening for people that were below 50, that it's not safe. So my question is, thermal screening, would that be a safer way to screen for breast cancer?
Bravo. Good question.
Good question. Thermography is the use of infrared technology to highlight an area that has a little more heat that may suggest an area of breast cancer.
You asked though if we could give any tips as to how people could reduce the incidence of obesity. Well, how do we gain weight? We have to take in the calories, and if we don't burn the calories up, then they're going to stay and become fat.
Welcome to Get Healthy with Dr. Cooper. Discover the secrets to amazing health and longevity. Learn how lifestyle medicine, the vaccine for chronic diseases, can profoundly influence mind and body. Learn simple solutions such as healthy nutrition, exercise, strong family bonding, stress management, and spiritual renewal will empower you to live a longer, healthier, and more abundant life. And now, here's Dr. Donna Cooper.
All right. Welcome back. This is our best segment yet. You know why? We have food. And this is food like medicine. You know, it's so difficult for us to eat healthy. And sometimes the children, we have to disguise what we're giving them to eat. So today, what do we have today, Chef?
We have an amazing black bean brownies.
Bean brownies?
Bean brownies. This is the best way to get our children to eat their protein in beans. Through a brownie.
There you go.
Yeah.
Why don't you show us what you're going to do? Are these really good? Are they delicious?
They're delicious. And the great thing is that we have an audience that they're going to give us our truthful taste. And then we have doctors as well that they're going to show us and tell us what they really taste like.
So do we have eggs in here or
no
butter?
Eggs, no butter, no flour. These are guilty-free brownies. Very easy, very simple, very delicious. You can try them home.
Aye.
So
let's go right ahead.
We're ready to go.
There we go, Chef.
You're gonna need a blender, okay? So get yourself a blender. 1 can of black beans, okay? These have been rinsed and washed.
And drained.
And drained, yes. Get all that liquid that comes with it, get it out. We want just the beans, okay?
That's right.
Then we have 3 tablespoons of coconut oil.
And you can also use olive oil.
Yes.
Alrighty.
And then we have right here coconut sugar.
Yeah, and that is the best sugar to use. Now, I don't recommend a lot of sugar, but this has less glucose and more fiber, so less dangerous for the diabetics.
Yeah. This right here, we have our flax seeds right here. This is going to take the substitution for the egg. These are 2 tablespoons with 6 tablespoons of water.
Right, so we have no cholesterol.
No cholesterol in these brownies.
But we have a lot of fiber and omega-3 fatty acid that we do need in our bodies.
Yep.
All right.
And we're going to add our baking powder. Okay, this is a teaspoon and a half.
That's correct.
Okay. Now we're going to add our pinch of salt.
Just a pinch.
Just
Remember,
a pinch.
salt is not good for high blood pressure. It's just a pinch of salt.
And we're starting to incorporate our flavors. This is our 1 teaspoon of vanilla. Okay, this is pure vanilla, not imitation, but pure vanilla. We want the nice flavor of vanilla. And now we have the daddy of them all. This cocoa.
And that's black. That's
This is the good stuff.
the good stuff. That's without the milk as well, right?
Exactly. No milk in
So
these.
that's the cocoa powder,
Yeah.
dark
And now
chocolate.
we're gonna put a
Blend.
lid in. Yeah. We're gonna blend. We're gonna
Is
pound
it
this on.
tight enough? Is it tight?
Yes, it is.
Okay,
So
go.
if not, well, there goes my coat, right?
It's that simple.
That simple. This right here, we have our dough ready to go. So once you get your dough ready, you're gonna want to get your pan. You're gonna spray this off and incorporate your dough into each little hole that your pan has.
Right. And how long are you going to keep this
These are
in?
gonna go for 20 minutes into the oven for 350 degrees.
Right.
So,
this will bake about how many? Maybe
well, this makes a lot. It all depends on your pan. If you make the small ones,
Like
it
these?
makes a big batch, more 24 of
Right.
them. Yeah.
Right. So then we put this in for about 20 to 25 minutes, and then it's ready to go.
Yes, it is.
All right.
It's that simple.
And you said it was delicious.
I hope it is. So
So then,
we're gonna give to our audience and
and
taste.
they're gonna take the test, right?
Yeah, because everybody that sees it at home, they see us test towards the end of our segment, and they're like, oh, they're just playing around because
Right.
we always say it's delicious.
exactly.
But now we're gonna give to our audience. We
All right,
want
Chef.
them to
Test.
to taste.
All right. And then, guys, you need to give us the answer, okay?
I'll give our audience, and maybe you could give our
The
our
doctors.
Yes.
But you know, Chef, if we had some ice cream, but
Oh,
the ice cream
the
that
ice
we
cream.
make,
So you have to go back to our shows and see when we make that ice
or
cream.
you can get my book,
Exactly.
Incredibly Delicious Vegan.
You have to get it. Where can they get it, Doctor?
Oh, get your website.
CooperWellnessCenter.com. And I know our producer right now is putting it down here, right? CooperWellnessCenter.com. So log in, get your incredibly delicious vegan cookbook.
And you'll have a lot of guilt-free.
Desserts,
Uh-huh.
ice cream. Imagine ice cream with the brownie.
I tell you.
Delicious.
Let's try it here, Chef.
I'll-
Go right ahead. I'm
I'll
going to get
pass
the
on
doctors.
to our guest here.
All
go.
right.
Here-
So let me
here-
get the
Here you go,
doctors.
here you go.
And Chef, you can continue. Let me pass you some plates, Chef. All right, doctors. I want you guys to taste and tell me what you think. Tastes like a brownie?
It's really good.
The texture is great.
Fantastic.
It's
Chef,
amazing.
can you get us some
Tell the
napkins?
difference, really.
And these are beans, and you know what? You
You
can
can't taste them.
taste the beans.
You can't taste
And if you're allergic to gluten, no need to worry. And if you have diabetes, no need to worry because beans are high in fiber. And we put cane sugar, so this is gentler on the blood sugar. All right? Now, Dr. Boss, you were...
sugar, you said it?
Huh?
Coconut sugar?
Coconut sugar. I have coconut sugar there. So if you want to just use the coconut sugar or the dark cane sugar, this is less processed.
Is that easy to find, the coconut sugar?
Oh yes, you could go to any health food store and you can get the coconut sugar there. All right. So you guys would not tell that this is beans, right? What do you think? No. You know, I also used to disguise vegetables for my children. You know what I did? I used to make muffin. They would not know that it's vegetable muffin, right? You were talking to me just now about your patients and what you suggest for the parents to do to increase the vegetable intake.
Yes, I get a lot of my parents that tell me when I'm showing them my little plate of how they should have half of it vegetables and a little bit of fruit. They tell me, oh, but the kids don't like vegetables. Don't like vegetables. But most of them like some fruits. And so the first thing I suggest is I ask, do you have any kind of blender at home that can make smoothies? And most people have one. And I say, put the fruits that the kids like. You know, whatever fruit they like, and add quite a bit of spinach. And so what the spinach does, it changes the color of your smoothie, but does not change its taste. And so you can get some vegetables in that way, and you can get some fiber in that way.
So there are so many things we can do, parents, in order to get your children to eat healthier and yet do not gain weight, because we know exactly what will happen as they gain weight. All right, so Dr. Brown, you practice here in the Rio Grande Valley, and I know you have the senior practice. But do you see a lot of diabetic patients?
Oh yes, so many diabetics. Diabetes is also one of the most common chronic conditions in the United States and of course here in the Rio Grande Valley. We just
And
mirror.
worldwide as
And
well. It's
worldwide.
growing. It's
Yes.
amazing.
I believe we have over 30 million diabetics here in the United States. And those who are pre-diabetic, those who are at increased risk of developing diabetes in the next 5 years, there are over 60 million of those. So close to 100 million people with diabetes and pre-diabetes.
Right. And if I were to just add a little bit, there's some now with diabetes, but they're not diagnosed. So we have over 100 million people in the United States with diabetes or pre-diabetes. And worldwide, we have about 400 million. So diabetes is a problem. And as we know, type 2 diabetes is really a lifestyle disease, which we can actually prevent or even cure using lifestyle. And you have listened to us talking about diet and exercise. It's just lifestyle changes that we need to make and you need to make in order to have a healthier lifestyle, healthier health outcome.
Also here in the valley, there's a huge prevalence of polycystic ovarian syndrome or disease, and it's characterized by obesity in most cases, insulin resistance. So you have this large group of pre-diabetic people or insulin resistant, and they usually are overweight. Yes, there are a lot of hormonal issues, but some of this can be corrected with lifestyle modification, with diet, exercise, etc. So this is another big population of people here in the valley where we live, and these patients are also at risk for precursors of endometrial cancer because of the unopposed estrogen that's usually present in this condition. So it's just a segue into
into the obesity.
I think with
I'd like
our-
to add something about pregnancy too. Pregnancy is kind of a stress test for both hypertension and diabetes. If you have diabetes and hypertension while you're pregnant, you're at a much greater increased risk of having both of those diseases later in life. So if you have it during pregnancy and you don't have it immediately after pregnancy, you need to be very, very careful about what you're eating and your lifestyle choices, because your chances of having those diseases later goes way up, in some cases above 50%.
And the initiative this year for the American College of Obstetricians and Gynecologists is actually pursuing this continuum, from pregnancy, catching the women in pregnancy and continuing to follow them throughout their lifestyle annually, for those who are may have had gestational diabetes or had risk of hypertension, just following them on a regular basis rather than, coming back 6 years later when they have their next baby, when they could have full-blown diabetes or full-blown hypertension.
So what do you
it's a
recommend
continuum.
when you say following them? Do you recommend a time period when they should come in and see the doctor and get their yearly
For the
physical?
diabetes, it's 3 months after they deliver. You're
Usually after
supposed to
6
check them
weeks. After 6 weeks or so, you should repeat their glucose testing.
Uh-huh.
But also, in addition to this, after their 6-week check, it's recommended that you, stress on the importance of following up at least annually.
Yeah.
And probably testing them again for diabetes annually, and
Well, they recommend every 3 years if that first one is negative.
Right.
Right. Dr. Brown, when you see your patients in the office, what do you recommend they do during their annual physical? So now they're not with the OBGYN anymore. They're with the primary care doctor. What are some of the recommendations?
There are some routine blood tests that we do each year on our patients. Number one, we always screen for diabetes. We screen for thyroid disease. Men over age 40, we screen for prostate cancer. And we screen for other cancers. We already mentioned the breast cancer, which we screen for. We screen for colorectal cancers, cervical cancer using the pap smear. Is there anything else that I'm missing, ladies?
Well, if they're diabetics, then they should have their eye checked.
If they're
once they-
diabetics, yes, then they have to be tested for eye disease. They also have to be checked for kidney disease.
That's right.
Diabetics are at increased risk for heart disease. It's one of the major killers of diabetics. About 75% of them actually die from heart disease, not from per se the high blood sugar levels, but the effects of this on the organs of the body. So most of them die from heart attacks and strokes.
Right.
And cholesterol too, as part of the screening.
What about your pediatric patients? Do you recommend yearly physical exam with them?
Yes, so for pediatric patients, when they are born, we tend to see them within the first few days. Then again, at 2 weeks, we do the PKU. It's a screening test, a screening blood test that tests for a ton of diseases that if we catch early, we can treat very adequately with no side effects, but if caught late, could cause a lot of problems for the kids. And then we see them again at 2 months for vaccines and checking how well they're growing, at 4 months, at 6 months, at 9 months, and at 12 months. Then we see them at 15 months, at 18 months, and at 2 years. Then we do see them at 2.5 years and then 3 years. By the time they get to 3 years, then we start seeing them every year. So we see them quite often when they're little.
And that is if they're healthy. Now, if they're unhealthy, then they need to go into the doctor. If they're vomiting, if they have diarrhea, if they have high fever. Am I not right?
Yes, you're right. Yes,
Right.
You're right. We see them when they're sick as well. And sometimes, especially with the teenagers, the only time that we can catch them is when they're sick. So when they're sick, if they're not too sick, we would also see them for the yearly physical at the same time as a sick visit.
Thank you so much. Dr. Matthews,
Yes.
while I was with the audience, someone asked me about the signs and symptoms of breast cancer. Would you like to elaborate on that?
Sure, yes. Breast cancer is largely non-tender, which makes it very tricky as far as diagnosing. The current standard is to do breast awareness, which we were just talking about this amongst ourselves, and we're going to include some kind of exam in there. They don't want us doing monthly exams anymore, but some kind of palpation, just be aware of the architecture of your breast is relevant and important. But there are, if you feel a mass, and it's non-tender, then that's something you need to bring to the attention of your doctor right away. If you feel a mass and it's tender, you still need to bring it to the attention of your doctor. However, breast cancer is usually non-tender. So there's also breast discharge. If you have a bloody discharge, that's very much a hallmark of breast cancer. Most discharges of the breast are not bloody. They can be from fibrocystic changes in the breast. Fibrocystic changes in the breast can sometimes mimic some of the signs of breast cancer. And so this is why it's important to do your early screening or your screening exams for early detection.
All right, so ladies, you're listening to us, and if you see any of that happening in your body, you need to see the doctor. I think it's a good place to take a break, so why don't we take a break? We'll be right back.
150 over 90.
180 over 111.
160 over 110. I had a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a stroke are far from invisible or silent. If you've come off your treatment plan, get back on it or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
If I would have followed a treatment plan, I would not be in this situation.
These ladies have done well. They have left us more informed than when we started. And now we're at the end of the show, and I'm going to ask each one to just give us some closing thoughts, things that you might have not mentioned yet and you want to get across to our audience right in the studio, as well as our TV audience. So I'm going to start with Dr. Daly.
Yes, certainly my pleasure being here today. Just in closing, I want to mention that the Well Woman exam is very, very important. in addition to history, physical, counseling and screening and discussion about screening is taken care of. There have been different guidelines recently about the need to have a pelvic exam or speculum exam every year. While this may not be necessary, this usually can be a shared decision between the provider and the patient, depending on symptoms. If there are symptoms, definitely you need to get checked, but if they're not and you just want general information we can discuss, then there can be a decision as to whether or not we're going to do a pelvic or a speculum exam. So don't be scared about coming in for your annual, because sometimes it can be just a discussion and we can discuss what else needs to be done.
Dr. Daly, I'm going to cut you there. You said symptoms. What are symptoms? What should they be looking for?
Symptoms, vaginal discharge, vaginal bleeding, itching, abnormal odor, painful intercourse, irregular menses. I didn't really speak much about endometrial cancer. I mean, there's not a true screening test for that, but it's usually quite easy, or I shouldn't say easy, but it's usually presents itself in terms of abnormal bleeding, which should then be followed up. The problem usually with diagnosing that is that a lot of people tend to just kind of wait, or maybe it's my period, even though one of the things that we talk about during the annual exam is that after menopause you really should not bleed. So any kind of bleeding, any kind of spotting is not normal after menopause and needs to be evaluated.
Thank you so much, Dr. Daly. Is that all?
Get your PAPs.
Okay.
Get your annuals.
I'm going to jump over to Dr. Brown. Anything you'd like to say as we close?
I think I made a great omission when I spoke earlier about hypertension. And I'll confine my closing comments to hypertension because it is such a widespread condition in our society today. As we mentioned before, 50% of all adults have blood pressures in the range of hypertension. And something I omitted, which I'm sure the chef he mentioned to me, he said, you didn't mention anything about salt. And yes, that's such a great omission because it's one of the first things that we say to patients who have high blood pressure, that they should reduce the intake of salt. And where do we find salt? There is table salt, which some people love to add. So there's that shaker on the table. So you need to put that down. Please do not have a salt shaker on your tables. Whatever you cook with, that's enough.
That's enough for you, Dr. Brown.
I think that's enough for me. I would just like to thank you for having me here today.
Oh, it has been
I really
a pleasure.
enjoyed it.
It's a pleasure. I'll have you again soon. Dr. Daly, did you?
Just one additional thing in terms of the salt. In the diet here, with rice, beans, everything, MSG is always added. The consommé, and that is has a very, very high concentration of salt and should be avoided. Chinese food, all those other things.
Soy
and
sauce.
most foods have MSG.
Right.
It's a flavor enhancer, so it's added to a lot of
So
things
one
that
has to
you're not aware
read
of.
the label.
Monosodium glutamate or MSG.
Right. So the recommended amount of salt per day is less than a teaspoon of salt. So you can start thinking about measuring your salt. Just limited amount, all right? Dr. Matthews, is there anything else you want to say as we close?
Yes, I would like to bring up the point that in pregnancy, everything we've talked about here applies to pregnancy, except that you're now dealing with two lives. A lot of people don't know that when you're eating, you're actually developing the taste buds of that child. So I tell my patients all the time, eat like you want your 2-year-old to eat, because what you're eating, that 2-year-old is going to want. Very important. Hypertension, the salt reductions, all of the things that apply to, about what we said, apply to pregnancy too. Still, the #1 cause of maternal mortality is cardiovascular disease. That's undiagnosed. So all of these things are relevant to pregnancy too, except I would say they're more relevant because you actually have 2 patients, not just 1.
That's right, 2 persons. All right, Dr. Boss, you're left for the last one. Come on, anything you want to tell us?
Yes, I do want to add a few things. I wanted to say that for the human papilloma virus vaccine, it is not mandatory, so it's just recommended, but we do highly recommend it. For the fact that it's not recommended, some people do not give it at 11 when we suggest it to them. But it's not too late. You can still give it. It's recommended up to age 26. And now there's a new recommendation that the FDA approved this month, that it's now from age 27 to 45. So even for the older people that are going to be seeing Heather and Giselle, they'll be able to get it. So yeah, you can still get the human papilloma virus vaccine for your child if you didn't give it to them at age 11. I wanted to mention that. And the other thing that I wanted to mention is that for the well checks that we do for the kids, we see them so often. We're doing lots of stuff. We're giving vaccines, we're checking how they're growing, their weight and their height just compared to themselves. We're screening for things like the acanthosis nigricans, which is a dark discoloration on the neck, which is a precursor to diabetes. It's usually you're getting pre-diabetic when you're having that, so we're screening for that. We're checking for scoliosis, and we are also giving the vaccines like I mentioned. So yes, even teenagers, please come see us for your yearly physicals. We know you don't like us as much anymore, but please come see us. And I want to say, Dr. Cooper, thank you so much for having me. I've had a wonderful time being here today.
It has been a blast. It has been a pleasure having you ladies. You're just a wealth of information. And if we want to change patient, change their family, change the community, and change our nation, we do that through empowering them with education. And that's exactly what you guys did. So I want to thank you so much for coming. And I'm sure I'm going to call you again on the show. All right? Let's give them a hand. All right. Welcome back to Get Healthy with Dr. Cooper. We have had an amazing show. Wouldn't you agree? You learned about breast cancer, cervical cancer, endometrial cancer, high blood pressure, diabetes, and a lot about pediatrics. Am I not right? These ladies did a marvelous job. But you know, some people might be thinking, wow, they discussed a lot about diet and exercise. We even had brownies made from beans. But changing lifestyle is not easy. It can be daunting. However, there is hope, and I want to leave you with hope because your Creator made you to stay healthy. As a matter of fact, in Jeremiah 29, verse 11, there is hope. The Bible says that I know the plans I have for you, plans to prosper you, to give you hope and a future. So don't be discouraged. Think that your health is in your hands. But if you need help, then find someone who can give you that help. So as we leave you, remember there is always hope. And I'll see you again next time. Same place, same station. May God bless you. Bye-bye.
This broadcast was sponsored by Cooper Wellness Center and Faithful Path International Ministries. For more information on how to become a patient or a sponsor, please contact us at 1-844-343-8935 or visit our website www.cooperwellnesscenter.com.